Hi everyone, my name is Janvi Srivastava and today I will be presenting on Our Dying Youth, an analysis of child and infant mortality rates around the world. But first, a little bit about myself. I'm a freshman or a rising sophomore at Scottsdale in Arizona. I love biology and especially neuroscience, and I'm passionate about doing research on these topics in later years. I'm also interested in economics, and I participated in and won a few state competitions for it. And in my free time, I like to play the violin, write poetry, read, and go hiking. All right, so introduction, a focus on infant and child mortality rates as a global health concern. So despite the impressive improvements towards lowering infant and child mortality rates in the recent decades, daunting social inequalities still persist. Focusing on infant and child mortality as a global health problem lets us address these stark inequalities in who gets to be healthy, which is far too often dictated by wealth, status, or nationality. So here I have a graph that shows the breakdown of child mortality by cause, and as you can see, the majority of deaths are due to diseases. Now, perhaps the most troubling part is the fact that the vast majority of these deaths can be easily prevented using simple, cost-effective measures. And later in this presentation, I will break down the major causes as well as prevention tactics. All right, so leading causes of infant and child mortality. I have them listed here, and the first one is birth defects. These birth defects, the most common ones are congenital heart disease, cleft lip, Down syndrome, etc. We also have preterm birth and low birth weight, maternal pregnancy complications, sudden infant death syndrome, malnutrition, a lack of childhood immunizations, a lack of hygiene, which may be due to practicing open defecation or not having proper hand washing, and diseases. And the three most deadly diseases when it comes to child and infant mortality is malaria, diarrhea, pneumonia, and finally we also have injuries. Now, social inequalities in infant and child mortality. So in this section, I will discuss social inequalities on a global, community, and racial level. So this graph here decomposes infant mortality rates by country. And as you can see, there's a lot of social inequality. 1/2 of all under 5 deaths are in a total of only 6 countries: India, Nigeria, Pakistan, the Democratic Republic of Congo, Ethiopia, and China. Additionally, a child in a developing country is almost 60 times more likely to die than a child in a high-income country. So what causes these disparities in infant and child mortality within a country, as well as among different countries? All right, so the statistics on this slide reflect the findings of a study involving 6 countries in sub-Saharan Africa: Benin, Central African Republic, Chad, Guinea, Mali, and Niger. So these percentages show the impact that these factors have on the inequality and the gaps between our mortality rates. So first, we have household differences. This is basically the wealth of your household, such as having access to toilets and the maternal education level, electricity, etc. We also have community differences, which is basically the essential infrastructure that your community has, like having proper healthcare facilities and public transportation. And finally, we have the effects of the country the child's born in. So the country effects, I don't have decomposed into specific factors, and that's because the effects of your country are mostly based on random variance and unobserved geopolitical differences. So what that basically means is, for example, if your country is in a state of war or has a lot of political turmoil and corruption, that may contribute to increasing infant and child mortality rates. So even though you can't directly quantify and put this into little categories and percentages, the effects of your country does have an impact on child and infant mortality. So mortality through the lens of racial discrimination. So as you can see, the graph on the right shows that non-Hispanic Black infants have a much higher rate of mortality than infants of other races. Now, why is that? So even as factors like income, education level, and socioeconomic status of the mother increases, African American infants are still far more likely to die than infants of other races. Now, why is that? There's a couple of reasons for this. So first of all, mental health. There are more mental health cases reported in African American women, and this problem is only exacerbated by the fact that mental health care often does not focus on the unique problems that people of color face on a daily basis, like the effects of racism and discrimination. Another major factor is the effects of the environment in communities of color. Communities of color are more likely to be located near busy roads, landfills, and air-polluting coal plants because of the systemic racism in the U.S. housing system over the span of generations. These environmental factors can harm the health of the mother during pregnancy. So methods of prevention for infant mortality. I have a couple listed here. The first one is using newborn screening. Newborn screening is when doctors simply take a blood sample from the newborn and test it. This simple procedure can detect many hidden problems early on. Next one we have is preventing birth defects. Now, aside from the obvious things like not using alcohol, drugs, and tobacco during pregnancy, mothers should also take the necessary supplementation such as folic acid to help lower the chances of certain birth defects. This is why it is absolutely essential to make sure that every mother in developing countries and high-income countries alike are getting the essential supplements they need during pregnancy. Now, this ties into my next thing, getting prenatal care. Having more healthcare infrastructure in all communities will allow mothers to get regular checkups during the course of their pregnancy, which can help doctors nip certain problems right in the bud. And finally, we have education on reproductive health and birth control. Making sure all children past puberty have been educated on reproductive health and methods of contraception is essential to help decrease teen pregnancies. Teen pregnancies have a higher risk for both the baby and the mother, especially since there is a greater chance of preterm birth and pregnancy complications. Now, methods of prevention for child mortality. I have a couple listed here, including vaccines, antibiotics, hand washing, and oral rehydration therapy. All of these measures are extremely cheap and can drastically reduce child mortality in developing countries, especially due to diseases like malaria, pneumonia, and diarrhea, which, as I mentioned before, are the most deadly ones when it comes to child and infant mortality. So in conclusion, while affluent countries can do their part in helping less developed countries lower their infant and child mortality rates by passing public policy for financial aid, I believe it would be much more beneficial for the general public throughout the world to become more aware of these problems and do their part for the overall health of our planet's children. Finally, these are my references. The one that I have at the top bolded is a study I mentioned with the 6 sub-Saharan African countries. So if anyone's interested, please go check that out. Now, at first acknowledgements, I would like to thank the lead heads of the Global Health Leaders Conference and all the featured speakers who have talked to us for the past few weeks for giving us such an amazing opportunity to learn from the world's best. Next, I thank you to the audience for giving me your time and attention. We are all the next generation's leaders in global health. And finally, thank you so much to my parents for inspiring me to follow my dreams and always supporting me no matter what. I have my email here, so if anyone has any questions for me, please do not hesitate to email me at any time. I will be happy to answer any questions. Thank you so much, everyone. It has been such an honor to present today. Have a great day.